The hind foot is made up of the talus or ankle bone, then the calcaneus or heel bone, which is just inferior to it. The ankle joint is the articulation of these two bones with the tibia and fibula. The midfoot, this region, is made up of the cuboid, the navicular, and the three cuneiform bones which serve as shock absorbers. The forefoot is the metatarsals and the phalanges, which on the toe are proximal and distal, and on the other digits are proximal, medial and distal. The talus has a head which is just above where it articulates with the navicular bone of the midfoot. The trochlea of the talus bears the weight of the body and articulates with the tibia, bearing the weight of the body. The sustenaculum tali, or talar shelf, is an eminence from the calcaneus bone just on the joint with the talus. There's a navicular tuberosity just under here on the side of the foot, and a groove of the cuboid bone running down its superior surface, and that's where the peroneus longus tendon attaches. The fifth metatarsal has a tuberosity or styloid, which serves as the attachment for muscles. Styloid means where a muscle attaches. The foot, like the hand, has retinaculae, which are thickened areas of fascia that prevent the bowstringing of tendons that lie beneath them. The anterior compartment of the leg contains extensors of the foot, and these are all innervated by the deep fibular or peroneal nerve. The extensor digitorum longus goes from the lateral condyle of the fibia, top of the tibia, downwards, and inserts into the middle or distal and distal phalanges of the lateralmost four digits, so not the big toe. And this extends the toes. The same function for the big toe is performed by the extensor digitorum hallucis, which inserts into the interosseous membrane and extends down to the phalanges, or the phalanx of the big toe. Hallucis just means relating to the big toe. The third muscle of the anterior compartment, the tibialis anterior, starts on the middle of the body of the tibia and travels down to the cuneiform bone of the heel bone. This controls dorsiflexion of the foot and inversion of the foot. The blood supply to all three of these comes from the anterior tibial artery. There's a third muscle, not that important, but you need to know it, called the peroneus tertius, which is also a dorsiflexor of the foot. The two muscles in the lateral compartment attached to the lateral shaft of the tibia. These are the fibularis longus, which reaches down to the fifth metatarsal. The fibularis brevis is the same area. It's attached to a slightly different part of the metatarsal, more on the outside. Both of the muscles control plantar flexion and eversion of the foot. Plantar flexion and eversion. Circulation is supplied by the superficial fibular artery, and cutaneous innervation by the sciatic nerve, as with all of the lower leg, and the muscular innervation by the superficial fibular nerve. When the sciatic nerve gets to the knee, it becomes the common peroneal nerve. Its other branch is the tibial nerve, which gives off branches to the gastrocnemius, popliteus, soleus and plantaris muscles in the posterior compartment, whilst the common peroneal the common peroneal splits into superficial and deep fibular nerves after this. Superficial goes to the lateral compartment, which is fibularis longus and fibularis brevis, whilst the deep fibula supplies the anterior compartment. The superficial fibula then, or the superficial peroneal, supplies the skin on the dorsum of the foot. It becomes cutaneous about 2/3 of the way down the leg. It's about here. The deep fibula also supplies the muscles on the dorsum of the foot. All of the muscles in the posterior compartment are plantar flexors of the foot. They all attach to the calcaneus behind ankle joint. So these are all plantar flexors of the foot. Of the deep part of the posterior compartment, you have the flexor hallucis longus, flexor, not extensor, remember, and that comes from the posterior aspect of the middle third of the fibula. Comes down underneath the medial malleolus here, onto the distal phalanx of the big toe. The flexor digitorum longus goes from the same place and inserts into all 4 phalanges of the digits. Finally, the third muscle in the deep part of the posterior compartment is the tibialis posterior, which originates on the tibia and fibula and goes down to the navicular and medial cuneiform bone. The cuneiform, remember, is the one in between the navicular and the metatarsals. It's those 3 shock absorber bones. The superficial part of the posterior compartment is the stronger part. That contains the soleus muscle. The soleus goes from the soleal line, which is just here on the tibia, and inserts onto the calcaneus tendon at the back of the foot. Incidentally, the calcaneus tendon is the attachment for all parts of, as I said, all parts of the superficial posterior compartment. Now, whilst soleus attaches to the soleal line below the knee joint, the gastrocnemius attaches above the knee joint, and this is important to remember. Gastrocnemius has 2 heads, a lateral and a medial head. It goes down over the top of soleus. Whilst finally plantaris comes from the lateral condyle of the femur and is a small muscle running across the back. The whole posterior compartment is innervated by the tibial nerve, and its blood supply is the posterior tibial artery. On the medial side of the foot, the deep flexors all their tendons pass below the medial malleolus before they enter the sole of the foot. The tendons are held in place by the flexor retinaculum, and this is known as the Tarsal Tunnel. Occasionally the synovial sheaths here become inflamed, compressing the tibial nerve as it runs through here. Now, the structures that pass through here are the tendons of the tibialis posterior, flexor digitorum longus, flexor hallucis longus, artery, nerve, and doublet of veins.